transport of thyroid hormones. Okay, so 99% is bound in the bound form and 1% is in free form. So 99% of the thyroid hormone is in the bound form and 1% is in the free form. So what are the different ways it is bound? It is bound to albumin, then it is bound to thyroid binding globulin. Okay, then the third way, it is bound to pre-albumin. It is also called as transthyretin. So three ways it is bound to. One, it is bound to albumin, then thyroid binding globulin, or pre-albumin or transthyretin. This 99% is in the bound form, only 1% is in the free form. Now what happens to these levels in hypothyroidism and hypothyroidism? Three things you have to always remember: bound form, free form and TSH. These are the three things you have to remember with regard to hypothyroidism as well as hypothyroidism. In hypothyroidism, there is an increase in the bound form, increase in the free form, and there is a decrease, low TSH. High bound form, high free form and low TSH. Whereas in hypothyroidism, the bound form will be less, the free form also will be less, whereas TSH will be high. Now you have to think why this will be high. Now to understand this, you should understand the regulation of thyroid hormones. So in the regulation, any regulation of any hormones is by negative feedback mechanism, that is hypothalamo-hypophyseal axis. Hypothalamus will release thyroid releasing hormone, okay, and thyroid releasing hormone will act on anterior pituitary. Okay, so anterior pituitary will release TSH. Okay, now TSH will act on thyroid gland, and the thyroid gland will release T3, T4 thyroid hormones. Now when the level of T3 and T4 increases, it can cause inhibition at the level of anterior pituitary as well as at the level of hypothalamus. Okay, now in hypothyroidism, there is increase in both the form of hormones. So when the hormone level increases, what happens? It will cause feedback inhibition at the level of hypothalamus as well as at the level of anterior pituitary. So there is a decrease in TSH. That's why this decrease in TSH. In hypothyroidism, what happens? This hormone is less. So this pathway is not there. That feedback inhibitory pathway is not there. So that will increase the level of TSH. So this is the basis of many of the case studies. They'll just give you the level of T3, T4 and TSH and or bound or combined form, and they'll ask you whether it is hypo or hypothyroidism. It's very easy if you understand this feedback loop.